If I could just take your temperature, if you could come a little bit closer.
Care homes aren't all the same. In this business, for that is what it is. As in others, you get what you pay for. It costs £1,500 a week to stay at Cumnor Hill House in Oxford, and it shows. Not just in the drinks, the menu, the in-house hairdresser, the for now suspended activities, but in how they've weathered this storm.
So this is where we're keeping the hub of all of our PPE. So we're trying to make sure that we've got adequate supply of masks, gowns, arms, cleaning supplies, disinfectant, stuff like Milton and anything that we would need for barrier nursing.
Yeah. And how much have you got in here in terms of supply now?
We've got enough for at least 8 weeks.
8 weeks?
Yes.
I mean, that's pretty good, isn't it?
It certainly is. We've been enabled to buy what we've needed to keep our residents safe.
This home hasn't had any COVID deaths. They've had just 5 infections. In COVID Britain, even in care homes, you're probably safer if you're richer. But it isn't all about money. They decided to lock down 3 weeks before national advice to do so. When they did, perhaps now incredibly, the authorities attempted to dissuade them.
Conversations with the Care Quality Commission were that this isn't according to the government and Public Health England's advice. Residents are much more beneficial having that social interaction, that stimulation and that meeting with their families. Depriving of them of that at this stage is effectively a deprivation of liberty, and you could be looking at having to take out a deprivation of liberty order on every single resident within all of your homes.
Do you think then, bluntly, that if other care homes had been advised to do what you did, which is lock down earlier, that lives could have been spared?
I think the logical answer is yes, without ever being able to truly demonstrate that. It certainly wouldn't have been, you wouldn't have been in a worse position.
Those care homes which push back do better on a whole manner of things, including testing.
The process is just anything but what is being communicated. We've got a real scenario only last week where we had a resident who was symptomatic. We followed the process, which was to make an application to get that resident tested. We were told that by PHE, no, you need to go to the CQC, the Care Quality Commission, our regulator. They're managing this. The Care Quality Commission said, no, that was a trial. It's not happening anymore. You need to go to a testing centre in Milton Keynes. That testing centre popped up and popped down within 24 hours because they couldn't cope with the demand. Went back to PHE. And if it wasn't for the fact that we had to name drop our local MP to say, this is what's ridiculous about this and how difficult it is to get tested, only then, the next day, 4 testers turned up at this home with 55 testing kits, tested every single resident, all come back negative, 100% clear, which is fantastic. But it shouldn't have to get to that point where you're name dropping an MP in order to deliver on what is being told and communicated to us centrally.
Not all carers and the cared for have been so lucky. In another part of Oxfordshire, we spoke to a carer who didn't want to be named. She speaks of the guilt she feels for those she cares for, locked away, with too few staff for their needs and the conditions they must now endure.
None of them have been showered for weeks because we can't. They're not receiving showers. And there's partly, I think that's partly to do with infection control because they don't have showers in their rooms, so it means taking them out of their rooms. But there's been no, well, okay, how do we do this then? What we've got to be able to do something. But this lady got really upset to me and she was very understanding and said, I'm not even asking for a shower, can you please just wash my hair over the sink? Just 5 minutes, because it hadn't been done for weeks. She felt disgusting in herself. It was itchy, God, I can't imagine how awful that would be. And all she wanted was that 5 minutes of my time, and I had to say no, because I had at least 6 or 7 other residents to get up in the space of probably just over an hour, and that's a non-essential task.
Her home has seen 15 deaths in a few weeks. In response, management organised a lock-in where staff stayed at the home for 7 days, having to live together cheek by jowl in makeshift accommodation, working night and day.
We quickly realised that although we were told it was 24 members of staff, we had 10 for 24/7 care for, at that point, a lot of very, very unwell people. I was working 15 to 16 hours a day on max 4 hours sleep for 7 days straight. Now, if any, that's not safe conditions for anybody to be working in, not for us and certainly not for our residents.
And all of this while having to wear the slightest of protection.
We've been asked by management to donate any spare bed sheets that we have, and then these bed sheets are then fashioned into gowns, washable gowns that we can wear over our uniform, and then the care home then wash, and we just pick up at the beginning of our shift. But that, in terms of PPE we have right now, some people are opting to wear hairnets that have been made available. Sometimes there are plastic sleeves, but that's really the extent of it.
So at the moment you're wearing, at least sometimes you're wearing washable donated bed sheets and hairnets.
Yeah, and a disposable mask, but for the majority of the shift. And that's the extent of it.
I mean, you must feel extremely unsafe and unprotected.
I've never heard the term lambs to slaughter be used so frequently as I have by my colleagues over the last couple of months.
There's no part of this country, no matter how rarefied or genteel, which escapes this care crisis. Expensive or modest, well-run or not, the homes have this in common too. No matter which you're in, those podiums in Whitehall and those speaking on them feel far, far away.